In public health centers across Trinidad and Tobago, essential vaccines are provided to all adults and children free of charge under the Ministry of Health's expanded program on immunization. For the public, the process is straightforward and seamless. But behind the scenes, maintaining the safety of vaccines that require cold temperatures of between 2 and 8 degrees Celsius is an important part of the process that requires careful coordination. A disruption in the electricity supply could trigger an emergency event in which hundreds of vaccine vials would have to be rushed to refrigerators in other locations to protect them from being destroyed by heat.
The security would have to notify their manager, and their manager would notify the area administrator, and they would get in contact with the nurse in charge of the institution so that the vaccines can be moved from the health center to the county medical office of health so that they can store it.
Even if it's on a weekend, and we have to ensure that they stay between the 2 and 8 degrees Celsius to get them to the other facility to maintain that integrity, because if we don't, then of course the vaccines are going to waste.
The situation became even more difficult in the rainy season when every storm alert elevated the risk of power outages.
With storm warning, there's a chance that there might be, power outages. So we will immediately summon to remove all the vaccines and take it to the general setting area where they have access to generators in case of the outage, because of course there's no telling how long it would be. I mean, there's 14 health centers in Victoria, right? 7 in the south, 7 in the north, and we all had to converge at the San Fernando General Hospital and store vaccines there. And of course, that was a chore, and then there's the chore of actually having to, take it back.
In 2022, Trinidad and Tobago's public health system experienced a technological breakthrough in vaccine storage when the Ministry of Health received the first of 62 solar-powered vaccine refrigerators from PAHO WHO.
What we do is support the countries to procure not only all the vaccines that actually are given here to the population, also procuring some supplies for the cold chain to provide the vaccination throughout the country, and also training the health personnel to be able to accomplish this.
It was an exciting time because we weren't sure what to expect when this solar-powered fridge arrived. So now we were able to keep our vaccines with or without power at the institution without having to move it.
I had confidence in this fridge because I knew it was reliable and it uses renewable energy.
Today, these refrigerators deliver a carbon-free, uninterrupted power supply to ensure that temperature-sensitive vaccines and medications are properly stored. Whatever reservations healthcare staff had quickly gave way to wholehearted embrace of solar energy.
I had a lot of questions about the solar power fridge when it came because I was wondering, really and truly, if the sun doesn't shine for a few days, what is going to happen? We did get a little education on how the system works because it's 100% solar powered and it has a battery that is charged from the solar rays, right? And when the battery is charged, that generates its own current that freezes the water in the refrigerator. And even if you don't have active sun, it can hold charge for up to 3 days without being exposed to direct sunlight.
For the past year, at least 3 occasions I've had power outages for 8 hours, upwards of 8 hours. Of course, they were planned, which makes it easier, so we knew that we would have had the power outage, but I didn't have to move a vaccine.
That convenience has been a life changer.
The massive improvement in efficiency achieved by the introduction of solar-powered vaccine refrigerators got a boost.
One of the areas that we looked at was temperature monitoring.
Because the first thing we do in the morning is to check the fridge, and before we leave we also have to check the temperature and we will chart it. So we have a record for the past months from January to now with the recording of the temperature of the fridge, and it has always remained within that specified temperature of 2 to 8 degrees Celsius.
However, this is only done during working hours. So they do it in the morning when they come in and then when they leave on the evening. There was no monitoring of the fridges on a weekend, on a public holiday. In Trinidad and Tobago, we have several long weekends, so there would be sometimes that there would be 4 days without the temperature of the fridges being monitored.
Recognizing that there was still a risk to vaccines due to gaps in temperature monitoring, PAHO WHO has facilitated an additional donation of devices that enable the temperature in these fridges to be monitored remotely.
So these remote monitoring devices really are devices that attach to the fridges, and the nurses are able to monitor the temperature on the weekend on their phone. And if there's any fluctuation or variation in the temperature, they'll get an alert. So they would know at that point in time that they should go and check the fridges so that we could be sure that the cold chain is maintained.
Every step along the way, vaccines remain safe and available for every child, every family, every time.
The appreciation needs to be there for where we have reached. Having solar-powered refrigerators, it's one step, but it's a great step.
PAHO WHO, powering health in Trinidad and Tobago, strengthening the cold chain, protecting lives.